Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Oncocytoma. Oncocytoma is seen in 3 to 7% of all solid lesions. Solid renal lesions are associated with oncocytoma. One important thing is oncocytoma differentiation with eosinophilic malignant renal cell carcinoma is difficult. Why? Because oncocytoma and eosinophilic malignant renal cell carcinoma both will have similar presentation. So, as a result, this oncocytoma and eosinophilic malignant renal cell carcinoma should be differentiated. So, if you see the pathology, in pathology, the grossly you will see that tumors are light brown or tan in color, and they are homogeneous and they are well circumscribed tumors. The tumors are light brown, tan in color, homogeneous, and they are well circumscribed tumors, and they are not truly capsulated. But what is important is presence of this central scar is important. This central scar is present in oncocytoma. So if you do an ultrasound examination, sorry, ultrastructurally, that is on microscopic examination, on microscopy you will see presence of many numerous mitochondria are seen. So these numerous mitochondria are responsible for the appearance. So there are many numerous mitochondria are seen in oncocytoma.
thank you and thank you for watching.